Since the outbreak of COVID-19 pandemic, the World Health Organization has called for international cooperation in combating it, both in terms of preventing its spread and in finding a vaccine. An international COVID-19 vaccines global access facility, known as COVAX, was set up to facilitate equitable access to COVID-19 vaccines, led by the Global Alliance for Vaccines and Immunization, Gavi. However, more than 4 months after the first vaccine was made available, rich countries continue to be criticized for ignoring the COVAX initiative, which aims to help developing countries to receive enough doses to vaccine at least 20% of their population. The World Health Organization says it is concerned about the $22.9 billion gap that has yet to be obtained to support the equitable access to COVID-19 vaccines. Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, says that what is even more worrying is that rich countries continue to buy all the available COVID-19 vaccines, while some have gone an extra mile to buy more doses than they need.
It's important to note, however, that money is not the only challenge we face. If there are no vaccines to buy, money is irrelevant. Currently, some high-income countries are entering contracts with vaccine manufacturers that undermine the deals that COVAX has in place and reduce the number of doses COVAX can buy. Even if we have the funds, we can only deliver vaccines to poorer countries if high-income countries cooperate in respecting the deals COVAX has done and the new deals it's doing. This is not a matter of charity. It's a matter of epidemiology. Unless we end the pandemic everywhere, we will not end it anywhere. The longer the virus circulates, the more opportunity it has to change in ways that could make vaccines less effective.
Dr. Athan Tashobya, an epidemiologist who also works with the World Health Organization, blames this issue to insufficient number of vaccinations compared to the number of those in need.
Some countries bought vaccine doses which are more than their national population. We believe that this is in spirit of one country wanting to donate doses to other friendly poor countries. What is being examined is also how to start mass production for vaccines. Pfizer and Moderna and AstraZeneca, which have already been authorized to produce the vaccines, should have partnerships with other pharmaceutical companies to help in mass production.
But how should poor countries campaign towards equitable share of COVID-19? Alex Nizeimana, an international policy analyst, explains.
First and foremost is that the countries work together. They must recognize the common challenge, which is limited access to COVID-19 vaccines, and collectively compete for the available doses through a common fund. If the USA orders for $1 billion worth of vaccines, it is fine that about 50 to 60 developing countries can put together the same amount of money and order for the same doses.
Africa is the continent that seems to be lagging behind in terms of access to COVID-19 vaccines, which reinforces inequalities between rich and developing countries, as President Paul Kagame recently told CNN's Richard Quest.
We have seen most of these things happen in the last 20 or so years, where Africa is lagging behind the rest of the world because of what Africa seems to be. And in that part of the world we live in that still has a lot of poverty, still is not considered as the integral part of the global economy the way it should be, and there's a problem of equity and so on and so forth. So Africa has that problem and we need to work at it and make things better.
The health sector says that in order for the world's population to return to normal life and economic activities to stabilize as it was before the pandemic, it requires that at least 60% of the world population gets vaccinated. Reporting for RwandaTV News, Athan Tashobya.